Thank you for coming. My name is Natalie Mara. I'm the Executive Director of the Ontario Health Coalition. We're here today to release our new report on long-term care in Ontario called Situation Critical. And the genesis of the report was that we were receiving increasing complaints from families and from staff members in long-term care that they were seeing increasing violence levels, or that they were the victims of increasing violence levels in long-term care. And so we decided to look into this much more systematically. And we found that actually the Ontario coroner has also systematically been looking into this. And in fact, every year for the last 6 or 7 years has flagged this issue for policymakers in the annual reports from their geriatric subcommittee. And what the coroner was looking at specifically was homicides in long-term care. And when we looked at the homicide rate that the coroner had discovered in long-term care, we found that in the 5 years preceding this report, there were 27 homicides in long-term care homes. And since the report was written, there are 2 more reported homicides by the coroner, so 29 homicides over the last 6 years in Ontario's long-term care homes. And when we looked at the homicide rate per thousand population, which is how they measure homicides in long-term care homes compared to, say, the largest cities in the country, we found that the rate is actually 4 times that of the city of Toronto, for example. And when we looked at a comparator of a similar sized city to the long-term care sector, so there's 80,000 people who reside in long-term care in Ontario, compared the homicide rate in long-term care facilities to an 80,000 person city in Ontario, we found that the homicide rate was actually 7 or 8 times the homicide rate of a similarly sized city in Ontario. So the bottom line is that the level of homicide in Ontario's long-term care facilities is higher than virtually anywhere else in our society. And when we dug a little more deeply, we looked at other types of violence in long-term care. We found that the violence rates all around, not just homicides, were escalating, and that homicides are the extreme end of a continuum of violence that is escalating in the homes, and by any measure is intolerable. It's crossed, what anyone can consider morally acceptable, and has to be dealt with. And so this report is really a heartfelt appeal to policymakers to finally actually take on this issue and deal with the level of violence that has become to a level that is beyond tolerable in Ontario's long-term care homes. We tried to look at what the causal factors are. Why is it that violence in Ontario's long-term care homes has escalated to this level? And what we found was pretty shocking, actually. Right now, access to care is extremely poor. There are 80,000 people living in Ontario's long-term care homes. There are 33,000 people, more than 33,000 people, on wait lists to get into the homes. And once they get into the homes, by every measure, the acuity level in the home, that is the complexity and the heaviness of care needs of the residents, has skyrocketed. So the care levels, the care needs have gone really very dramatically up. About half of the residents demonstrate behaviors that can include things like kicking or punching or grabbing or pulling. And when we talk about homicide in long-term care, that's what we're talking about. A resident with dementia who might grab a piece of metal and beat another resident to death with it, or a resident who might push another resident off the bed or push them against a wall, and the resident who is frail and vulnerable, often has dementia themselves, will subsequently die of their injuries. It doesn't mean that there's criminal intent, but it is a tragic it's a tragedy for both parties and all of their families and everyone concerned. So when we looked at the acuity levels, we could see that they were rising dramatically, but the actual care levels in the homes has decreased. So while the acuity levels have gone up, the hands-on care, that's the turning, the feeding, the supervising, the sitting with residents and so on, those levels have actually gone down. And by every measure that we could find, the result is increasing violence. We looked at the staff injury rates in long-term care, and we found that long-term care in Ontario has the highest injury rates of any industry in our province. So we now have the results of this big look at what all of the government data involving care levels, involving acuity of residents, involving behaviors and violence and injury in the sector. And what we see is a picture that just cannot be denied. We see that Ontario has cut more hospital beds than anywhere else in the country, that those hospital patients have been offloaded, both the chronic care and the psychogeriatric care patients have been offloaded into long-term care homes that are not staffed or designed or resourced to take them. We see that they're funded now at a third of the rate that they were when they were in hospital, and that as the care needs have gone up, the actual care levels have gone down, and the result is extreme levels of violence and ultimately homicides in long-term care. We are asking policymakers to take a stand and actually resource the sector, ensure through enforceable required care levels that hands-on care increases in the sector, that all Ontario long-term care homes have behavioral supports for people with behaviors that can include aggressive behaviors that might harm someone, and ensure that there's adequate training and support to provide the care that residents need, and stop the offloading of hospital patients in order to save money at the expense of the health and safety of the residents in long-term care. I'm happy to have here with me today Lance Livingston. He's a senior himself whose mother recently had an experience in which she was pushed out of hospital without anywhere to go. And I asked him if he would come and share his account today of what it's like for Ontarians trying to seek care and long-term care.
So my mom was 84 at the time she ended up in the hospital in April. So then we were trying to get her. She fell, and then she couldn't get out of bed. So they tried to do therapy in the hospital for her, and we were looking for long-term care for her because she could no longer go home back to her apartment, and there wasn't anybody in our family could look after her because we were all retired, all in our 60s at that time. And so when we started looking, and because of all the needs she did, some of them wouldn't even take her. She said she needed too much, and some of them said, well, it might cost $7,000. Well, who in this...
Per month.
Yeah, $7,000 per month. And who can afford that $7,000 a month in this province? The only way you can do it is if you're wealthy, you got lots of money, because the ordinary person cannot do that. So we end up not being able to find a place for her. We were trying for long term, but it was a long wait. And then she finally just gave up and said she didn't want to live anymore, and then stopped taking her pills. And because, in my opinion, she couldn't find a place to go in her mind, and she just said, "Why be here?" And she ended up passing away in July. So, but I have another thing. I'm with Unifor Retirees. Also belong to an organization called Kirk and the National Pensioners, and we all fight for the same thing, for affordable long-term care for our seniors. They built this province, they built Canada, and we have to treat them with dignity and make sure they can afford to live when they're retired. There's so many retirees who cannot afford paying $6,000 a month for any kind of care, and we have to stop this injustice to our seniors and make sure they get the care that they deserve. And so that's one of the main reasons why I'm here speaking, not just on behalf of my mom, on behalf of all seniors, because we need the help from the governments to make sure we have places for our seniors to go to.
Thank you. That was great. Are there any questions?
What solutions are you proposing, Natalie, for the, are you suggesting, say, more hospital funding would help with the offloading of the psychogeriatric patients?
Yeah, Ontario's closed almost all of its psychogeriatric beds. What we found that there were about 170 left. The recommendations are that there should be I think 3 per thousand. I have to look up the numbers, but anyway, many, many, many more than that. So we're far below benchmarks in chronic care beds, in psychogeriatric care beds. So yes, we need to improve hospital funding. This notion of alternate level of care, all these people that are supposed to be shifted out into long-term care, they are chronic care patients. They are what in yesteryear were chronic care patients, and the shifting is to try and cut the cost for them by 2/3. And what's happening is, of course, that the care levels are just far too low to meet their needs, and it's dangerous. And so, yeah, we're saying stop the hospital offloading. We need to rebuild hospital capacity in this province. By every measure, we're below every other province in Canada, below all international standards for the number of hospital beds per capita. But in long-term care specifically, we need enforceable, regulated care levels. If you put your child into daycare, there's a ratio. There can only be a certain number of children per staff. There is no such thing in long-term care. So we have situations like have come up in the Elizabeth Wettlaufer inquiry where, at night she had 60 patients and the other nurse on the floor had 100. And so, of course, there's no supervision. Nobody's reporting on poor care or anything like that. People are barely even getting care in those circumstances. So we need an enforced, regulated, hands-on care level that is safe. And the best evidence supports a 4-hour minimum care standard. So what we're asking the government to do is impose a 4-hour minimum care standard that would guarantee a minimum average care level for all residents in long-term care. And then the other piece is that only under half of the homes have Behavioral Supports Ontario in the homes. And this is proven to help with residents with aggressive behaviors like the kicking or the pulling or the yelling or the screaming, that kind of thing. And it really does help because it's trained staff who know how to deal with those circumstances. So in addition, we're calling for behavioral supports to be spread to all of the homes in Ontario that have people with what they call responsive behaviors, which are these behaviors that can range to aggressive behaviors that can cause harm. Any other questions?
Could you tell us a little bit more about the methodology for how you got the staff injury stats?
Yeah, we looked at the Ministry of Labor statistics for lost work time injuries. And what we found was healthcare has the second highest level of all industries, but long-term care has double the number of lost time injuries of healthcare in general. And so long-term care actually has more lost time injuries than any other industry in Ontario. And it doesn't give the reasons for those injuries, but we know anecdotally and from the studies that have looked at the levels of violence that there are a lot of injuries due to violence, due to kicking and punching and pulling and hitting, as well as the lifting injuries that the care workers often get. And so what's interesting is the studies that looked at this in Ontario also looked at Nordic countries and other jurisdictions, and they found far lower injury rates. So these are not necessities. These are policy choices. In all of these measures that we looked at, other provinces do better than we do. Ontario really has the highest occupancy rates, the longest wait lists, the highest acuity, by anything that is measured that's comparable. We really are sort of ranking very, very lower at the bottom of Canada and international measures. And I guess I just want to underline, because it always comes down to this question of affordability. And, I think Lance showed very clearly, if we don't pay for it publicly, people still have to pay for it. This is needed care. People can't go without it. And right now, one of our local co-chairs in Oshawa couldn't come today, but her father is waiting for long-term care in Oshawa, and she has to pay $6,000 a month for assisted living. $6,000 a month in order to get him care. He can't be in hospital. They want him out of hospital. There is no place in long-term care, and there are tens of thousands of Ontarians lost in this limbo where they can't afford the private care, and there is no public care available for them. It's not a question of affordability. Someone has to pay. It's cheaper for us to pay publicly and better to provide a system that actually is safe and secure and provides for people's needs.
Have you spoken with or plan to speak with Minister Elliott on this issue?
We have been asking for a meeting on other issues since the beginning of December. We've been totally given the runaround and haven't been able to get a meeting on anything. But we did send her the report and we asked her for a meeting on it.
So given that, how confident are you that the government will be taking action on what you're asking today?
I think it's our job to insist, to make enough noise, to insist that the government has to hear us and has to take action on it, and we will do that. Thank you.